Great. So, this is Mr. L, who's a healthy 11-year-old. I'm Michelle, and I am doing a head-to-toe assessment for my grad school DNP class at UMKC, and I'm going to do a head-to-toe assessment. His mom's in the house and has given permission and consent, and Mr. L has also given permission and consent. So I'm going to start looking at his skin. He's got good color of his skin. He's got good texture and good turgor. He's well hydrated. And now I'm going to feel for his head and his scalp. And I've just washed my hands and used hand sanitizer. And his hair is good color, black. Any tenderness on your head? No? No? Great. And his scalp looks clean, and his cephalocaudal shape and midline is excellent. And now I'm coming around to his eyes and his face, and I am going to look at his face, which is midline. His skin is good. I'm going to feel for his temporal arteries, which are great. I'm going down to feel his nodes, his lymph nodes. His submental nodes are good. His submandibular nodes are great. Nodes palpated or felt. Then I go on to his periocular and his postauricular, and then his occipital nodes, and then I go down to his posterior cervical nodes, and then come around to his anterior cervical nodes, and then none there, and then I go down to palpate his supraclavicular nodes, and then none there, and subclavicular nodes, and then none there. I'm going to go to his cranial nerve 5 and ask him to crunch your jaw back down. Any tenderness? No. Great for his masseter muscle in cranial nerve 5. I'm then going to ask him to shut his eyes and tell me where he feels my fingers on his face for cranial nerve 7. Or cranial nerve 5, where do you feel your fingers? My fingers?
My forehead.
Forehead. Great. Where do you feel my fingers?
My chin.
Excellent. Where do you feel my fingers?
My cheeks.
Excellent. Where do you feel my fingers?
My nose.
Excellent. Great. Thank you. And now I'm going to feel assess for cranial nerve 7 with his smile. Can you smile for me? Great midline smile. He's an awesome 11-year-old. Can you frown for me? Frown as if you're mad, angry at mom or me. Pucker your frown. You can't frown. He doesn't get stressed. This is great. Excellent, don't worry. Excellent, you got it there. Can you, as if you're blowing kisses, pucker your cheeks. Yeah, excellent. You must play, do you play any musical instruments? No? Awesome. You're going to have a girlfriend soon. He'll be good with his girlfriend. Excellent. Cute dimples. Can you blow your cheeks out for me? Excellent. Great. Thank you so much. And then I am going to go down. I'm going to go to, can you shrug your shoulders? Excellent, for cranial nerve 11. Excellent, you can relax, thank you. And then I'm going to go to his ears. I'm going to first feel his ears, his pinna and his tragus. Any sensitivity? No, and good color. Excellent. I'm just going to look in his ears. Are you okay with that? Awesome. And because he's a bigger boy, I'm going to pull his ears slightly up and back and look at his eardrums, and they're pink pearly grey and no wax and clean. I'm going to look at the other one, up and back and pink pearly grey eardrums, no wax, no tenderness, it's all good. I'm going to do the whisper test for him, which means I'm going to cover your one ear and I'm going to stand behind you and say a word, and you're going to tell me what I say. Excellent. So,
Tangerine.
okay, and cover the other ear. Excellent.
Purple.
Excellent. So his cranial nerve 8 is working with his the whisper test, and now I'm going to go to his eyes, and he's got great eyes and equal and in good alignment. No discharge. The conjunctiva and the sclera are clear. And I'm going to do some tests on him. There we go. And first test I'm going to do is the accommodation test, which is CN3. Follow my fingers. Excellent, excellent. And then I am also going to do the where his pupils constrict, which is also cranial nerve 3, and it is, I can't say the word, where his pupil, it's not convergence, anyway, I'm going to shine a light in your eye. Is that okay? Excellent. And another one. Excellent. And so it's consensual, where the one pupil constricts as the other pupil constricts, and he's got great, that is great. I'm going to assess his peripheral, gross and peripheral vision, which is cranial nerve 2. And so tell me when you look at the candles, and tell me when you see my fingers moving. There? Okay.
Yeah, I see them.
Excellent. 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 So his cranial nerve 2 is intact. That's great. And now I'm going to assess his his nose for patency. His nose is midline. Can you cover one nose, one there, and sniff for me? And the other one? Excellent. And I'm going to look for any patency. Excellent. His nails are nice and clean and patent, which is really great. Now I'm going down to his mouth and his throat, and excuse me. And I'm going to open your mouth for me, please. Stick out your tongue. Excellent. Can you touch your nose with your tongue up and down, up, yeah, and down. Excellent. And sideways, and the other way. Excellent. So his tongue is midline, which is cranial nerve 12, and and open your mouth again and stick tongue to the roof so I can see under. Excellent. His gum line is pink and moist. His salivary glands are present. Not too much saliva, appropriate. He's had a good diet. His teeth are white and intact. No sensitivity areas. Chew for me like you were chewing an apple or something. Any pain? No. His TMJ is good. I'm going to look at the back of his throat and his tonsils. So stick out your tongue and say ah. Hang on 1 second. Say ah. Excellent. His cranial nerve 9 and 10 are intact. His uvula is midline. His tonsils are not present. And so now I'm going down to his throat, and I'm going to feel his throat, palpate his throat for tenderness, masses or nodules. There's no sensitivity. Am I correct? No pain anyway? Excellent. I'm going to feel for his carotid pulse on either side. Excellent. He's got a good swallow reflex. I'm going to listen for carotid bruits. His trachea is midline, and his thyroid glands are no sensitivity around his thyroid glands. Excellent carotid pulses and no bruits. Excellent. And then I am going down to his neck, and I'm going to ask you to extend your neck backwards and flex it forwards. Touch your chin. Excellent, thank you. And sideways to the right. Excellent. And to the left. Excellent. Any pain anywhere? No. Excellent. And we'll come back to more shoulder stuff with the arms. I think I'm going down to listen to his posterior chest. And first I'm going to palpate his posterior chest and say 99 for me.
99.
Excellent. Fremitus, and take a nice deep breath. Excellent. And he's got great excursion. And and full movement and equal and bilateral and no tenderness on your back?
No.
No. Excuse me, coughing. And now I'm going to oscillate his lung sounds on his back posteriorly. And I'm going to take a nice deep breath. Excellent. And another one. Excellent. And another one. And another one. And his bases. And he's nice and clear. Another one. And then lift up your arms slightly. Auxiliary. Excellent. And another one. Excellent. Awesome. Nice and clear. No crackles. No movement. And now I'm going to do the same anteriorly. Excuse me. And then nice deep breath. Awesome. Great. He's a healthy clear. Awesome. And then final one for the bases. Lift up your arms slightly. Awesome. Awesome. Great. Nice, clear on all lobes. No pain, no tenderness, no masses, no nodules, nothing abnormal detected there. Now I'm going to listen to his heart sounds. I'm going to listen to his aortic on the right sternal border, second intercostal space, his pulmonic on the left sternal border of the second intercostal space. His Erb's point is in the third intercostal space, and his tricuspid is in the fourth intercostal space, and mitral valve is in the fifth intercostal space, and his apical pulse rate I will detect as well. So that's what I'm going to listen to. And his heart rate is 78, and his S2 is greater than his S1 in the apical and in the aortic and pulmonic areas, and mitral and tricuspid areas. His S1 is greater than his S2. Now I'm going down to his upper extremities, and I'm going to look at his hands and his fingers. If you can bring them up, awesome. And can you flex your fingers? Excellent. And extend them. Nice. Excellent. And squeeze my hands. Awesome. He's got 5 out of 5 grip strength. And I'm going to check his cap refill. He's got excellent under 3 seconds of cap refill. I'm going to take his radial pulses. Excellent. He's 78, which matches his apical pulse. Can you push my hands and resist my hands? Excellent. And resist my hands. Excellent. And no deformities, no pain, no lesions, no masses, nodules, redness, tenderness, broken skin. His skin's intact. His turgor's good. His texture's also excellent. And now I'm going to ask him to flex his wrists for me. Down and up. And sideways, opposites. So like, excellent, and then together, back, excellent, great, and no redness, no tenderness over his wrists areas. And then I'm going to ask him to flex his elbows for me and extend them. Excellent. And show me your biceps. Yeehaw. And push down on the bench to show me your triceps. Yay! Great. And bring your shoulders together and back. So he's got good abduction and adduction. And then can you rotate your muscle, your thumbs? Excellent. So he's got good abduction and adduction in his thumbs. Excellent. And then I am going to ask him to shut his eyes and tell me where I feel him on his arms. So shut your eyes. Excellent. Where do I? Yeah, excellent. 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 And I think this concludes our time together and our assessment. This is a healthy 11-year-old whose skin is intact and general health is excellent. And thank you so much, Mr. L, for your time. Let's hope that all recorded. So